Hi everyone, welcome to Medicine Note YouTube channel. In this video we are going to see about temporomandibular joint. It is the only movable joint in the skull as well as it is the only synovial joint in the skull. Bones are which is above by the mandibular fossa of the temporal bone. Here it will be the temporal bone. The temporal bone below there will be a fossa which is known as mandibular fossa, where the head of the mandible largest. Below is by the head of the mandible. This is the bone of the TMJ, which is temporomandibular joint. The auricular surface it is concave and it is formed anteriorly by the squamous part of the temporal bone and posteriorly by the tympanic part of the temporal bone, and it is separated by squamotympanic fissure. Again it is divided into two by downturn part of tegment tympani. It is separated by a squamotympanic fissure. It is again separated by the tegmentum tympani into two. Anteriorly, the squamotympanic fissure, which is ligament of malleus, posterior to the pterygotympanic fissure. Now you will see about the fossa. Anteriorly to the auricular tubercle or root of zygoma, below to the articular surface and concavo-convex and head of the mandible. The joint is a synovial joint, a variety which is condylar variety. Axis is multi-axis. Now the articular disc, which is bilaminar disc, it separates the articular end of the bone and made up of fibrous cartilage, degenerated part of the tendon of the lateral pterygoid. Now the shape is concavo-convex. It divides into the joint cavity into two parts, upper cavity and lower cavity. Upper cavity is known as squamomeniscal compartment, which is used in gliding movement, and the lower compartment which is known as meniscocondylar compartment, which is used in gliding as well as in rotation movement. The attachment are anterior to the lateral pterygoid. Posteriorly it divides into two, which is upper part as well as lower band. The upper band is by squamotympanic fissure and the lower part is by the neck of the mandible. The parts are anterior part, posterior band as well as intermediate band. These are the parts of the temporomandibular joint. The ligaments of the joint are fibrous capsule, spinomandibular ligament, stylomandibular ligament and lateral temporal mandibular ligament. The fibrous capsule is covered by above by the margin of the mandibular fossa, below to the neck of the mandible. It is covered totally the mandibular fossa as well as the neck of the mandible. The synovial membrane lining the fibrous capsule. Now you will see about the spinomandibular ligament, which is the second one. It is formed by the remnants of the Meckel's cartilage. Attachment is above by the spine of the sphenoid, below to the lingula of the mandible. The structures piercing it are mylohyoid nerve and vessels. Relation lateral, medial. The lateral are mandibular nerve, otic ganglion, auriculotemporal as well as medial and lateral pterygoid. The medial are wall of the pharynx, which is stylomandibular ligament, and it is thickening of the investing layer of deep fascia extending from the stylohyoid process of the temporal bone and the angle of the mandible. Stylomandibular process is the thickening of the investing layer of the deep cervical fascia. This extends from the stylohyoid process to the temporal angle of the mandible. It separates the parotid gland from the submandibular gland, and it is pierced by the external carotid artery. It's the lateral temporal mandibular ligament. It is a thickening of the deep fascia from the root of the zygoma to the lateral surface of the neck of the mandible. It supports the fibrous capsule. The nerve are auriculotemporal nerve, which is the branch of sensory division of the posterior division of the mandibular nerve, and mesenteric nerve are the nerve supply of the temporal mandibular joint. The artery are deep articular artery, the branch of first part of the maxillary artery. The movements are depression of the mandible, opening of the mouth by lateral pterygoid, protraction, retraction, chewing movements, and masseter, which is used in auricular axis. Chewing movements are side to side movements. Opening of the mouth is maintained by the lateral pterygoid muscle. Thank you. For more videos, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. Or else if you have any new other topics to suggest, please do comment it in the comment box. Thank you.